All right, let's walk through this subciliary step dissection. If you're doing anything with facial trauma or orbital surgery, this is a technique you absolutely need to have in your toolkit. So let's get right into it. So let's dive in. The whole point of the subciliary approach is to get great access to this really delicate anatomy. The goal is to get beautiful exposure, just like you see here, but you have to be incredibly meticulous to avoid those post-op complications. Here's our game plan. We're gonna break this down into 5 parts. We'll start with why you choose this technique, then walk step by step all the way through to closure. It's a clear framework you can use every time. Okay, first up, let's talk about why this step technique is so often the way to go. You know, understanding the alternatives really helps you appreciate why this one is so elegant. Look, you've got a couple of ways in, a skin flap, a skin muscle flap, but the step dissection has a major advantage. It's all about meticulously preserving that pretarsal portion of the orbicularis oculi muscle. And that is so important for lower lid function. And here's the real payoff, the clinical benefit. The step approach is specifically designed to help you dodge those common and pretty significant complications. For your patient, that means a much lower risk of ectropion and just a way better cosmetic result. All right, we know the why, so let's get into the how. We'll start with the prep work, because getting this part right really sets you up for success for the entire case. The prep really breaks down into 3 key phases. First, protect the globe. Second, mark your incision precisely. And third, make that initial skin incision. Nailing these first steps is absolutely essential for a clean, safe dissection. First things first, globe protection. A tersa raffi suture is a must. But notice here, it's not just for safety. It gives you fantastic control and traction on that lower eyelid, which is invaluable for keeping things on tension while you dissect. Now this number is critical. You're gonna mark your incision about 2 millimeters inferior to the lashes. It's a super reliable landmark, and it lets you hide the final scar right in a natural crease. Okay, when you make the incision, be precise. You're going through skin only. You want to cleanly expose that orbicularis muscle underneath without nicking it. Remember, that muscle is what we're working so hard to preserve. All right, now for the main event, creating the step that gives this approach its name. This is where the real elegance of the procedure comes through. The first move in the dissection is to develop this subcutaneous plane. You're carefully separating the skin flap from the pretarsal muscle fibers for about 4 to 6 millimeters. This keeps that muscle attached right where it needs to be. And this sagittal view is brilliant. It shows you exactly the plane you're in, just under the skin, leaving that all-important muscle layer completely intact. Visualizing this cross-section is key to staying on track. Next up, we create the step. You do this by dissecting through the muscle inferiorly, and then you develop a brand new plane between the orbicularis and the orbital septum. Now you're deep to the muscle, heading right for the rim. Here it is, that step in a cross-section. You can clearly see the 2 different dissection planes. That little bridge of pretarsal muscle is your step. That's the structure that protects the orbital contents. So our flap is developed. Now we can move on to the final steps to get down to the bone. This is our target. Now you retract the flap inferiorly and boom, you get this beautiful, clear view of the periosteum over the anterior maxilla. And notice how the orbital septum is still intact, holding back that orbital fat. It's a nice, clean field. Here's another really important measurement. The periosteal incision has to be made 3 to 4 millimeters below the orbital rim. If you go any higher, you risk transecting the orbital septum where it inserts, and that can cause all sorts of problems. Okay, now you'll use a periosteal elevator to strip the periosteum from the bone. You're entering the orbit in the subperiosteal plane. This is a safe, avascular plane. It's basically your highway down to the orbital floor and rim. And here's our result. Fantastic visualization of the whole surgical field, and we got here with minimal disruption to all those delicate eyelid structures. From here, you've got direct access to deal with the fracture. Finally, let's talk about closure and the big takeaways. Remember, how you close is every bit as important as how you open. This right here is the single most critical step in your closure, resuturing the periosteum. It puts all the soft tissues back where they belong, and most importantly, it gives that vertical support to the lower lid to prevent ectropion. So let's recap the highlights. 1. Preserve that pretarsal muscle to maintain lid function. 2. Make your periosteal cut well below the rim to protect the septum. And 3. Make sure you get an anatomic closure to support the lid. You master these points, you've mastered the technique.
When you do this with precision, this is the kind of result you can expect. Excellent function and aesthetics. So as you move forward in your training, here's something to think about. How will mastering this approach change the way you manage orbital floor fractures?